Heather. I'm going to be your nurse today. Can you verify your name and date of birth for me? All right. Could you tell me what you're here for today? And then I would ask them if they're in any pain, if they use any assistive devices at home, such as canes, walkers, or braces. I would have assessed vital signs. To check for orientation, I would ask them where we are, what day of the week it is. And then I would be looking at their overall mood, their appearance, the way they're dressed, noting their hygiene, noting any odors, noting their overall mood, the way they're talking to me, looking at their facial expression. And then I would start with the cranial nerves. So cranial nerve 1 is olfactory, so I would have 2 different scents, and I would have them include one nostril and identify the scent, and then include the other nostril and identify the scent with their eyes shut. And then during this, I would also check the patency of the nerves, so I would have them breathe, and then breathe with the other nostril. And then cranial nerve 2 is the optic, so I would use the Snellen chart, and I would have them stand 20 feet away and read off the letters. Cranial nerves 3, 4, and 6 are the abducens, oculomotor, and trochlear. So then I would have them follow my pen, and I would draw the H, and I would be looking for nystagmus of the eyes and any other abnormalities such as quivering. And then cranial nerve 5 is the trigeminal. So I would have them report light or pointy touch. So I would have them bite down and close their eyes. And then I would tell them to open their eyes and to continue biting down, and I would palpate the muscles. And then cranial nerve 7 is facial, so I would ask them to smile, frown, and puff out their cheeks. And then cranial nerve 8 is auditory, so I would go on both sides of the ears, and I would just have them tell me which side they hear the finger rubbing on. Cranial nerve 9 and 10 is glossopharyngeal and vagus. So I would use the tongue depressor, and I would check for the gag reflex. And while I'm doing this, I would also have them go ah and test for the rising uvula. And then I would have them repeat light, tight, dynamite. And then cranial nerve 11 is the accessory. So I would have them shrug against resistance and then turn their head both sides against resistance. And then cranial nerve 1 is hypoglossal, so I would have them stick out their tongue, put it up, down, and side to side. And then moving on with the integument, I would pinch the skin over the clavicle to check for skin turgor, and then I would be looking at their arms. I would be feeling temperature, I'd be looking at hair distribution, be feeling the moisture, looking for any scars, lesions, marks, and then I would be looking at the fingers, looking for clubbing of the nails, testing for capillary refill, making sure it's less than 2 seconds. And then I would also palpate the radial pulses bilaterally. And then moving on to the legs, I would do the same down here. I would also be checking for edema. I'd be looking at hair distribution, any lesions, marks. I would be looking at the toes. I'd be feeling the temperature, moisture. I'd be looking for capillary refill, and also for clubbing of the nails as well. And then I would palpate the pedal pulse, and then also the posterior tibial. And then while I am here, I would palpate the femoral pulse. All right, and then moving on, I would hand hygiene, and I'd be going back to the head, and I would be looking through the hair. I'd be looking for infestations, overall hair distribution, color, any lesions here as well. And then moving on to the face, I'd be looking at overall symmetry, looking at the neck. I would ask them to swallow to test for their ability to swallow. I would be looking at the trachea, making sure it's midline. I would palpate the carotid on both sides, one at a time. And then I would use my stethoscope, and I would be listening for bruits. So I would just have them hold their breath while I'm doing this. and then let it out, and hold their breath again. And then I would palpate the thyroid gland to check for enlargement. And then I would check range of motion by having them go ear to shoulder, both sides, and looking to the left, right, and back and forward. And then I would also have them sit back and look to the left, and then also to the right, checking for JVD. And then I would locate the lymph nodes, so occipital, post-auricle, pre-auricle, tonsillar, submandibular, submental, supraclavicular, and infraclavicular. And then moving on to the eyes, I would be looking at the overall hair distribution on the lashes and the eyebrows. I'd be looking at the sclera, I'd be looking at the conjunctiva. I would pull down and look. I'd be looking for sagging and drooping of the eyelids. And then I would test the pupil reaction. So I would have them look at my nose, and I would do this with lights dimmed. And I would look at the pupil I'm shining the light in and the other one to check for the accommodation of the light. And then to check for accommodation, I would have them look at me and look at something behind me. And then for convergence, I would have them follow my pen to their nose. And then I would identify the red reflex. So I would be looking for the shine of the eye. And then I would also note the size of the pupils, looking at the iris. And then moving on to the nose, looking at the nose, making sure the septum is midline, noting nasal mucosa. And then looking at the ears, noting their placement, noting any drainage. And then I would also palpate the pinna and the tragus, asking if they're experiencing any pain. And then I would percuss over the mastoid process. And then I would use the otoscope. And I would look in the ear, I would pull it up and back, and I'd be looking for the tympanic membrane, making sure it is pearly and gray. Moving on to the mouth, I'd be looking at the lips, the teeth, the tongue, the gums. I'd be looking at their throat. I already tested for rising uvula. I'd be looking at tonsils, their teeth. Now moving on to the respiratory. I'd be looking at their inspiratory and expiratory phases of respiration, the anterior and posterior. I'd be looking for the use of accessory muscles. I would be doing this on bare skin as well. I would palpate the intercostal spaces, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and then I would percuss. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And then I would auscultate, and I would just have them take a deep breath in and out when I place my stethoscope. Again, I would be doing this on bare skin. Five, 6, 7, 8, 9, 10, 11, 12. And then I would do the same thing on the back, except for auscultation, there would be 14 fields. And then on the back, I would also check for lung expansion by pinching the skin together and asking them to take a deep breath out and looking for my fingers to move apart and the skin to flatten. And while I'm there, I would also check the costovertebral angle, so I would go along the angle of the rib and tap my hand with my other hand to check for kidney tenderness. Next, I would move on to cardiac. So I would auscultate the 4 cardiac landmarks, and again, I would be doing this on bare skin. So aortic is the second intercostal space right of the sternum, and then pulmonic is the second intercostal space left of the sternum. Tricuspid is 4th intercostal space to the left of the sternum. And mitral is mid-clavicular line to the left of the sternum, 5th intercostal space. And then I would palpate the apical pulse. I would have them lean forward, and then I would have them lie on their left side with their left arm under their ear, and then I would auscultate the PMI for a full minute. Moving on to the abdomen, I would be looking at it from 2 different angles, noting symmetry, contour, hair distribution, any lesions, looking at their umbilicus, looking at veins, noting the color, and then I would auscultate. And then I would listen at the abdominal aorta for bruits. And then I would percuss. And then I would palpate, asking them if they feel any pain with the palpation. And then I would check for rebound tenderness. And then moving on to musculoskeletal, I would have them sit up and I would look at their overall gait, their appearance, their posture. I would test for coordination. I'd have them go like that with their hands on their knees and then have their feet dangling off the bed to touch their toes on the ground. And then to test for strength, I would have them take their arms and push against me and pull against me, and the same thing with the legs. And then to test for range of motion, I would have them supinate and pronate, and then flex and extend, and then do the same thing with the legs. And then for inspecting joints, I would palpate and inspect the elbows, asking if there's any pain. And then I would do the same thing with the knees. And then I would feel the brachial pulse bilaterally. And then I would do deep tendon reflex. So I would have them dangle their feet off, and then on the patellar tendon, I would check for the reflex of the leg. And then with the brachial tendon, I would put my thumb over the brachial tendon, and I would just hit the hammer on my thumb and kind of feel for, more so for the flexation of the arm. And then I would have them stand up, and we would do the Romberg test. So I would have them put their feet together and their hands at their side, and I would reassure them that I would be there with them, next to them, and I would have them close their eyes. And I would do this for a full 30 seconds, and I'd be checking for swaying. And then I would have them do the tandem walk, so heel to toe. And then I would have them walk on their tippy toes. And then I would have them walk on their heels. And then I would have them walk normally and just kind of looking for coordination and balance while doing these things. And then to test for immediate memory, I would have them repeat after me, tube, tree, sidewalk. And then for remote, I would have them tell me their birthday. And then recent, I would have them tell me what they had for breakfast. Mm-hmm. And then I would look at their spine from laterally and posteriorly. I'd be looking for kyphosis, lordosis, and scoliosis. And then I would palpate along the spine, ask them if there is any pain when doing so. doing a check over. Okay, and that is everything.